There is so much misinformation out on the web, it's phenomenal. What we're going to address today are myths and misperception in wilderness medicine. I'm a PA, been doing emergency medicine, urgent care medicine for 43 years. I've kind of specialized over the last 20 to 25 years in wilderness medicine. If you're new to the channel, that's really what we're about. If you like that kind of stuff, subscribe, give us a thumbs up, you know the drill, all that stuff. All right, so one of these myths and misperceptions is you should not suture or close a wound in the outdoors, should not suture it specifically. And it does not stop the bleeding. That's insanity, truly. If you want to close a wound, but number one, let's get this straight right from Jump Street. Suturing a wound, if you go to an urgent care or ED and you get your wound sutured, are you bleeding profusely when you get home? No. Now, in major trauma, no. But in lacerations and wounds, suturing does stop the bleeding. You're in the outdoors. It also depends on all these different factors. How long will it be before you get back? How bad is the wound? I don't expect the vast majority of the population watching this to suture a wound, but you can duct tape it. Oh my gosh, don't use duct tape on a wound. It will cause skin irritation and you'll peel the skin off. If you have a major wound and you're 2 or 3 days from getting back to base camp, to a clinic, go ahead, you got duct tape, it's not a problem. I have this happen all the time with my patients. They come into urgent care, we remove the duct tape and we deal with that accordingly. Not a huge issue. So we've talked about all kinds of methods to close wounds, and I'll put those videos down below of how you should close it, what's the best when you're in the outdoors, all right? So that is one myth, that suturing does not stop bleeding. It absolutely does. All right, one of the second myths out there is that in high altitude pulmonary edema, it doesn't cause chest pain. Okay, well, we have to look at physiology here briefly. So if you're climbing and you're at 10,000 feet, then you're jumping to 12 to 14,000 feet, and you have a hard time breathing, what's happening in your lungs? You're having fluid that is building up in your lungs. We won't get into the absolute details of that. If you have fluid in your lungs from congestive heart failure, high altitude pulmonary edema, you're going to be short of breath. And guess what the number 2 symptom complaint is? Chest pain. Yeah, you got fluid in your lungs. A lot of times these individuals are breathing and they have chest pain. So yeah, that's a symptom. Chest pain, coughing. Sometimes you can cough up some pink blood-tinged sputum. That's not uncommon. Yes, you should descend, and we have a whole video on high altitude pulmonary edema, and we'll put that below. All right, so what is another myth and misconception in the outdoors? Let's go with, should you put a topical antibiotic on your wound? It doesn't really matter if you're going to be back in 2 or 3 days at all. In urgent care, we do not, as we've talked about many times, we do not use Neosporin or triple antibiotic because it has neomycin in it. About 10 to 12% of the population is allergic to neomycin. So we use bacitracin. That is the one that we use. So if you want some topical antibiotic, you're a week from getting back, throw it on the wound. It's not a big deal. It's going to help. It's not an issue at all. You're not going to put it in the wound. You're going to put it on top. Not a major problem. All right. One of my specialty areas is these little 8-legged creatures, ticks, which are rapidly becoming a pain in the butt over the last decade. So we're going to dispel a myth and misconception right now. So does a tick have to be engorged in order for you to get Lyme disease? Absolutely not. Does it increase your chances of getting Lyme disease if the tick is engorged? Well, of course. That means it's been on there for a longer period of time. But I had 2 studies, which you saw at the beginning, and I'll put them right here that you can look up yourself. And it shows, these are like, studies are like 5 years old. So one of them, Dr. Katz did this awesome research and showed that less than 24 hours, he had like 1 out of 10 ticks, and the individual got Lyme. They also did this with mice, and they found out that, yes, the longer the tick is on you, the increased chance you have of getting Lyme if the tick is infected with Lyme disease. So number one, what's going to matter is, are you in an area, a geographic location that has a high incidence of Lyme? Number two, how soon do you get the tick off? Now, a lot of research is showing that if you're in one of those areas, it's okay to go ahead and give 2 tablets of doxy as a prophylactic move. CDC does not recommend that, but I've done that numerous times. You're not going to get a positive Lyme disease test for up to 2 to 3 weeks. I can verify with my own experience, anecdotal. I had a patient that came in, had a tick on them, had it on for a day and a half. And I know that because the lady went fishing in a farm pond and came back home, and then she comes in with this tick. We removed it. It was a deer tick. She chose not to be treated. She wanted to wait for the labs. I had her come back in 3 weeks. We drew the labs, positive Lyme. The tick was not engorged. So in these studies, they show repeatedly that it doesn't have to be engorged. It does increase your chances. A tick on your body less than 24 hours is not going to be really super engorged, guys. So don't forget, there's 4 stages of a tick. There's the egg stage, tick lays its eggs. There's the larva stage, nymph stage, adult stage. It wasn't up until less than 10 years ago we found out that the larva stage can give you Lyme disease. Rare, but it can. So why is that so important? In order for the tick to have Lyme disease and to give you Lyme, it has to feed on a rodent, a mouse, a squirrel, a rabbit, a deer, fall off, the tick is infected, and then bite you. The larva stage, if it's infecting you, that's telling some of the researchers that the egg stage has Lyme in it. So this is relatively new, all right? But less than 1% of all the Lyme disease that we've seen is coming from that larva stage, and then the percentages go up dramatically after that of the nymph stage and the adult stage. So what happens when this tick actually bites you? So it bites you. It has the bacterium, the Burgdorfia bacteria in it. It's biting you, and basically what it's doing as it's biting you, it's spitting into your system at the same time. Bite, suck, spits, bite, suck, spits. Wonderful scenario, right? However, some of the individuals are saying that when you pull that tick out, or when the tick falls off, that's when you get infected. That's not completely accurate at all. So that tick can infect you in less than 24 hours. Just so you're aware of that. It is possible, and it doesn't have to be engorged. All right, let's do another myth and misconception. That actually leads to another myth and misconception that you should not really, people think, oh, well, you can put nail polish. You can take a match, blow it out, and put it on the tick. And that's just going to irritate the hell out of the tick, and at that time it's going to exude more of the bacterium into your bloodstream. Not a good move. So the tick removal, we've done that a bunch of times. It's all over the internet. You take tweezers, go at the base of the skin, go at 90 degrees slowly and pull it out. Myth and misconception. Here we go. Hypothermia. You do not die immediately or within seconds or minutes of once you're immersed in frigid water. Let's say below 20 degrees, for example. All right, so one of the ways that you can tell when you read something or you find someone on TikTok or on YouTube and you know that they're really not on their ball game when it comes to medicine is when they either are selling something to you or they make an all-inclusive statement. You're not going to hear me ever say 100% of the time this is going to happen. You're never going to die with hypothermia within seconds if you fall into the water. Actually, you can die within 10 seconds. And how is that going to happen, you say? For example, you go into the water, you're 60 years old, you're old like I am, and as soon as you hit the frigid ice cold water, you kind of go like this. and you suck in a little bit of water, not a lot, and you have laryngeal spasm and you die. And that's called dry drowning. And on autopsy, there is no water in the lungs whatsoever. Another way is within less than 10 minutes is you can get ventricular tachycardia. So you're immersed in this ice cold water and your heart just beats rapidly and you can die that way. Now, strictly from hypothermia, yeah, that's going to take some time. But there are all kinds of mechanisms you will not hear me say. And the reason why that is, imagine this, okay? Someone passes on or they have a bad outcome in medicine. And I'm on the stand. Mr. Williams, let me ask you something. You're going to tell me that everybody, no one has ever died from hypothermia? Is that what you're trying to explain to me? Are you telling me, Mr. Williams, that no one has ever got Lyme disease from a tick that's been on them less than 24 hours and it's not engorged? Is that what you're telling me right now as they're trying to close the suit on the person who has neurological issues and can't walk from Lyme disease? So my point is, you got to be careful when you hear someone make generalized statements. Another myth. This guy gets confused with poison ivy. One of the reasons it gets confused with poison ivy is because in the fall it turns red like poison ivy. This is Virginia creeper, 5 leaves. People have even confused this for pot, and that's bizarre. Pot has 7, this has 5. And so there's 2 types of Virginia creeper. See, I'm touching this. There is a true Virginia creeper, and the Virginia creeper has little hairs on it on the stem. And that Virginia creeper can cause an irritation to your skin because Virginia creeper has oxalate crystals in it. Now, I'm touching this, I'm rubbing this on my hand. Look, I am not freaked out about this. The chances of someone getting a poison ivy type rash from this is very nil. Now, you can be allergic to any plant. You can be allergic to actually nettle and have an allergic reaction to nettle. But this is Virginia creeper. I'm touching the stem. I'm breaking off a leaf. I'm not flipping out that it's going to give me some rash. Now, urushiol or urushiol is the sap from the toxidrome plants of poison ivy, poison oak, poison sumac, and for the most part, poison oak is west of the Rockies, poison sumac is Georgia, Florida, the Carolinas, and in the Midwest we have poison ivy. The urushiol sap can, if you have a amount, let's say some sap about the size of a pinhead, it could actually infect about 500 people. And that's how potent poison ivy sap is. Now, this plant here, obviously you see it creep up the tree. It has these little abilities to attach. Let's see if I can find one. Yeah, you see how it's a wooden, like a wood stem here? So that's important to note. The other thing is when this plant, if it's on the ground and does not climb, it also can be called woodbine, and that's more low to the ground than this vine that's taking off here. So just wanted to clear up a myth. Can Virginia creeper cause a rash? True Virginia creeper, absolutely, it can cause a redness and an irritation. Now, I'm going to show you a bunch of articles here to explain that you can't trust newspaper articles on the internet. As you read all of these little headlines, you're going to see, oh my gosh, Virginia creeper, it's really bad. It's going to cause this and this and that. No, I mean, like I said, anyone can have an allergic reaction to any plant. I've even seen it with pine needles. But you're not going to get that blistery type rash. Despite what you see on the internet, you're going to look up the fact that you got a true Virginia creeper and a false Virginia creeper and look up the differences. But don't be that afraid of this. All right, guys. That's a bunch on myth and misconceptions. Keep your eyes on the rise and your face to the wind. We'll see you next time.